Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Farhana binti Mohd Rosli. So today, my crew members, Fadhillah, Aqilah, Farah, Anis, Haizatul, and Sharita, we are going to present on our PBL of Pharmacology. So I will proceed this presentation with the overview of the trigger first. So a 69 years old teacher had a severe chest pain right after he climbed the stairs. He was rushed to the hospital, and on the way to there, 300 milligrams of aspirin was administered. He also underwent medical examinations, and the results are as follows. There's no vesicles in the lungs. He has hypertension for 10 years, and also a type 2 diabetes mellitus. He's a heavy smoker, and he has been taking alcohol for 10 units per week. He has osteoarthritis on the knee, and his father died following myocardial infarction at 60. And he has also been taking diclofenac MR tablet 75 milligram and nifedipine MR tablet 20 milligram twice daily. And he has a high total cholesterol level. And upon further investigation, the result from ECG also indicate ST elevation of 3 millimeter in the inferior leads. Preliminary diagnosis was made for him, which was myocardial infarction, and further tests will be done to confirm the diagnosis. Based on the trigger, the teacher had a severe chest pain. So, what actually causes the chest pain? The chest pain usually is triggered by physical activities such as climbing stairs, exercise, and walk. This is due to the fact that during physical activities, heart need to pump faster and work harder to deliver necessary blood flows to the body's muscles, because during physical activities, there is an increased activity level of the body's muscles, and that's why the body's muscles demand more oxygen. Therefore, chest pain usually occurs when there is a reduced blood flow to the heart muscle, resulting from narrow arteries. So, the heart doesn't get an adequate supply of rich blood oxygen. Narrow arteries are commonly caused by coronary artery disease due to a build-up of fatty substance or plaques inside the arteries, which is called as atherosclerosis. The plaques may also form clots and clog the arteries when they break off, which is why oxygen-rich blood cannot reach the heart and eventually causes chest pain and angina.
Okay, so next I will continue to the next part, which is aspirin. So what is aspirin and what is the function? So aspirin is known as acetylsalicylic acid. Aspirin also in a group of medication or salicylates. It also classified as non-steroidal anti-inflammatory drug, which is preferably called NSAID drug. Aspirin also used as a medication to reduce pain, fever, and inflammation. It also can reduce swelling. So next, what is the mechanism of action of aspirin? So aspirin is non-selective and irreversibly inhibit both forms of cyclooxygenase. Cyclooxygenase, or also called as COX, divided into two forms, which is COX-1 and also COX-2. With aspirin, it can block the subsequent biosynthesis of prostaglandin and also thromboxane. However, aspirin is more selective to COX-1 compared to COX-2, and it affects more delicate on COX-2. So, aspirin is inhibit COX-1 function. So, what is the function of COX-1? COX-1 is contributes in blood clotting. So, with the usage of aspirin, the COX-1, the blood clotting progress could be reduced and prevented. Okay, why is he administered with high dose aspirin, which is 300 milligram, and what is the effect? So, aspirin 300 milligram is considered as high dose aspirin as it is higher in strength, while low dose aspirin is classified with 75 milligram. So 300 milligram is considered high dose aspirin. So 300 milligram of aspirin can lower a high temperature, which is fever, and it also relieve mild to moderate pain, ache, and also swelling of inflammation. Aspirin for high dose aspirin also is used to improve survival in emergency situation of a heart attack and reduce the symptoms. For example, in this case, the retired teachers having chest pain. So with the aspirin, it could reduce its pain, which is chest pain. It also can reduce other symptoms for heart attack also, which is shortness of breath, radiation or inflamed towards the arm or neck, and other more. So with the aspirin, by chew a 300 milligram of aspirin tablet will help in stopping the blood clot and will reduce the symptom and relieve the pain for the patient. Okay, so next I will pass to the next presenter.
Okay, now I will proceed to the physical examination of this patient. Upon the physical investigation, there is no vessel crackle. So first and foremost, we need to know what is vessel crackle. Vessel crackle is a bubbling or crackling sound originating from the base of the lung when the doctor examines with the stethoscope. So usually this vessel crackle indicates the condition with excess fluid in the lung, for example, pneumonia, pulmonary edema, and interstitial lung disease. So this patient has no vessel crackle, so this shows that there is no problem with his lung. Okay, next slide. Okay, in the trigger also, it stated that this patient are a heavy smoker, which he consume more than 40 cigarettes per day. Then he also consume hard alcohol, approximately 10 units per week, and he has osteoarthritis at the knee. So the question that appear here is, does a heavy smoker consume a high amount of alcohol and osteoarthritis can be the factor of his chest pain? So the answer is yes, these three factors can be the factor for his chest pain that he get. Okay, so I will explain each of the factor. Next slide. And the first factor is the heavy smoker. Smoking can harm nearly every organ in our body, for example, our heart, our lung, our eyes, and others, because the chemical in the tobacco smoke can harm our blood cell and damage the function of our heart. The smoke also can damage the structure and function of our blood vessel, and this will create the tension in the blood, increase the risk of arteriosclerosis, which is the building up of fat and cholesterol at the artery wall. So this will lead to the chest pain. The next factor is high alcohol consumption. For high alcohol consumption, it can increase our blood pressure and may cause irregular heartbeat and chest pain, even in the healthy individual. And for heavy drinking for many years can cause the heart muscle to expand, and this will weaken the heart muscle. So this also can be the factor of this chest pain. Lastly, the factor is osteoarthritis. Osteoarthritis may affect indirectly to the heart of this patient because especially for the patient that have osteoarthritis at the knee, and they will have lack of exercise, and therefore this will lead to other complications, for example, the accumulation of fat and cholesterol in our body. Moreover, for this patient, aging thickens and stiffens the arteries. So this will increase the blood pressure and lead to the hypertension and cause the chest pain. From the trigger also, it is stated that his father has died from myocardial infarction. So this may be also the factors of his chest pain, because myocardial infarction can be inherited from family members. And one of the risk factors of myocardial infarction is from inheritance. That's all for my part. I pass to the next presenter.
Okay, now I will explain about the nifedipine, which is one of the drug used in one of the drug that the patient has been taking for before. Okay, what is nifedipine? Nifedipine belongs to a class of drugs called calcium channel blockers. It helps to lower the blood pressure, to treat Raynaud's phenomenon, and also to prevent angina. Nifedipine acts by blocking the calcium channels in smooth muscle and cardiac muscle. The blockage of this channel prevents the entry of calcium ions into the cells during depolarization. This will reduce the peripheral arterial vascular resistance and dilates the coronary arteries. This action then will reduce the blood pressure and increase the supply of oxygen to the heart, alleviating the angina. The most common side effects from taking calcium channel blockers include headache, flushing, constipation, feeling tired, and swollen ankle. This nifedipine is not suitable for some people, including those who have recent heart attack, heart failure, or unstable angina, and diabetes. From the trigger, it is known that the patient has been attacked by angina, so nifedipine is stopped immediately after the admission. It also not suitable for diabetes patient because the nifedipine may affect the level of sugar in the blood. Finally, it is advised to not eat or drink grapefruit juice while taking nifedipine because grapefruit can increase the concentration of nifedipine in the body and make the side effect worse. That's all from me. I will pass the presentation to the next presenter.
So for my part, I will present diclofenac. Diclofenac is non-steroidal anti-inflammatory drug, NSAID. It used to release pain, swelling, and inflammation. Commonly, it used to treat rheumatoid arthritis, osteoarthritis, and gout. In this figure, the patient used diclofenac to treat osteoarthritis. The mechanism of action of diclofenac is by inhibiting both KAHS1 and KAHS2. Although diclofenac has same class with aspirin, which is non-steroidal anti-inflammatory drug, but it has different mechanism of action. So next slide. Before we go further, let me briefly explain the function of KAHS enzyme. KAHS1 function in activate platelet and protect stomach and intestine lining. KAHS2 function in platelet inhibition. Lastly, KAHS1 and KAHS2 function in renal perfusion, produce inflammation and produce pain. Okay, let's discover how the diclofenac can reduce pain. When looking at the function of KAHS1 and KAHS2, which produce pain and inflammation, when the patient consumes diclofenac will inhibit the prostaglandins that produce pain. Consequently, the pain will be reduced. We want to discover why the patient has to stop taking diclofenac during the admission. Okay. So one thing we need to know, although diclofenac inhibit both KAHS1 and KAHS2 enzyme, but it actually more prone to KAHS2 inhibition. Again, we look at the KAHS2 inhibition, which to inhibit platelets. Okay, so the diclofenac function is opposite to KAHS2 function, which when the diclofenac is consumed, it will deactivate the platelet inhibition, resulting to increase the platelet coagulation and also promoting vasoconstriction of the blood vessel. This event may increase the risk of cardiovascular disease. As in this trigger, the patient has myocardial infarction. And if you look at the history of the patient, he also has hypertension. So that is why it is dangerous for the patient to consume diclofenac when he had the myocardial infarction. Lastly, another side effect of diclofenac can lead to acute kidney failure. When we look at the KAHS1 and KAHS2 function, which is role in renal perfusion, right? So diclofenac will inhibit the KAHS1 and KAHS2 inhibition. So when it inhibits the KAHS1 and KAHS2 inhibition, it will constrict renal arteriole. And when the renal arteriole being constricted for a long time, so it may lead to acute kidney failure. So that's all from me. Thank you.
Moving on with the cause that indicate ST elevation. The ST segment represents the interval between ventricular depolarization and repolarization. And the most important cause of ST segment elevation is myocardial infarction. Based on the diagram, the left one shows the normal result for ECG, while the diagram at the right side indicate the ST elevation. The ST elevation might be because of myocardial infarction. ST segment elevation, myocardial infarction is the term cardiologists use to describe a classic heart attack. It is one type of myocardial infarction in which a part of the heart muscle has died due to the obstruction of blood supply to the area. The ST segment refer to the flat section of ECG reading and represent the interval between jagged heartbeats. When a person has a heart attack, this segment will no longer be flat but will appear abnormally elevated. Okay, the diagram shows the symptom that someone might face during the ST elevation myocardial infarction. The symptoms include nausea and vomiting, discomfort, pain around the shoulder, and many more symptoms. We proceed with the mechanism of ST elevation. The ST segment elevation occurs because when the ventricle is at rest and then repolarized, The depolarized isotonic region generate electrical current. They are traveling away from the recording electrode. Therefore, the baseline voltage prior to the QRS complex is depressed, which is the red line before R wave. When the ventricle become depolarized, all the muscle is depolarized during the ST segment. So that zero voltage is recorded by the electrode, the red line after the R wave, the red one. When the ventricle is completely repolarized after the T wave, the baseline is once again negative as in the resting state. Therefore, the net effect of the depressed baseline voltage is that the ST segment appear to be elevated relative to the baseline, the last one. That's all from my part.
Okay, next we proceed to the what is acute myocardial infarction. So acute myocardial infarction, also known as heart attack. A heart attack is a life-threatening condition that occur when the blood flow to the heart muscle is blocked and causing tissue damage. And this is usually the result of the blockage of coronary artery. Blockage can develop due to the build-up of the plaque. Plaque is the substance that mostly made of fat, cholesterol, and cellular waste product. And what are the symptoms? So the symptoms for myocardial infarction are pressure or tightness of the chest pain or pain in the back, jaw, and other area of the upper body, shortness of the breath, sweating, nausea, dizziness, anxiety, cough, and fast heart rate. Can relate to the trigger one. When a retired 69 years old teacher complained had a severe chest pain after climbing stairs and at his house, and he might have a acute myocardial infarction based on the symptom that he shown. So, okay, next is what are the cause of myocardial infarction that due to the blockage of the coronary artery or narrow due to the build-up of the plaque. So there are several causes that may lead to the blockage in the coronary artery, such as the presence of the bad cholesterol, saturated fats, and trans fat. So bad cholesterol is also known as a low density lipoprotein that will stick to the wall of the arteries and produce plaque that block the blood flow in the artery. So that is the saturated fats. Saturated fats are commonly found in meat, dairy product, butter, and also cheese. And these saturated fats may lead to the increasing the bad cholesterol and reduce the amount of the good cholesterol in the blood system. And last is the trans fat. So trans fat can be found in a variety of processed food and typically lists on food label as hydrogenated oil or partially hydrogenated oil, such as cake and cookies. And moreover, people who have high blood pressure, high cholesterol level, diabetes, and high blood sugar level, also smoking, age is higher than 69 years old, and has a family history who has experienced cardiovascular disease at a young age, which is age 55 or 65 years old, also contribute to the myocardial infarction. So this factor can relate with the trigger when a retired 69 years old teacher who has type 2 diabetes mellitus, high cholesterol level, heavy smoker, and also had father died following myocardial infarction at age of 60. There are several medications that can be used to treat myocardial infarction, such as aspirin, thrombolytic drugs, antiplatelet agents, and also beta blocker. So for the aspirin is used to reduce blood clotting, does help to maintain the blood flow through a narrow artery. And the function of aspirin also can be used as the pain relief. And this also can relate to the trigger when teacher was administered aspirin when he was on the way to the hospital, so that he can release the pain that he got from the heart attack. So next is the thrombolytic drug. The example of thrombolytic drug is Nimes, Ritavez, and Septez. Function to dissolve a blood clot that block blood flow to the heart. And thrombolysis may involve the injection of blood busting drug through an intravenous drug or through a long catheter that deliver the drug directly to the site of the blockage. And the earlier the patient get the thrombolytic drug, the greater the chance to survive and less heart damage. So that is the antiplatelet agent. Antiplatelet agent help to prevent new clot and keep existing clot from getting bigger. And lastly, for the beta blocker, the example of beta blocker is metoprolol, carvedilol or bisoprolol. And the function of beta blocker is for the reduction of oxygen consumption of the myocardium by lowering the heart rate, blood pressure, and myocardial contractility. So last is for diagnosis. So there are several tests that can be used to diagnose myocardial infarction, such as electrocardiogram, blood test, chest X-ray, CT scan or MRI, and also echocardiogram. So the function of electrocardiogram is used to treat heart functioning by measuring the electricity of the heart. For the blood test, is used to check the protein or enzyme that present in the blood. This is because certain heart protein leak slowly into the blood after the heart damage from the heart attack. For the chest X-ray, is used to check the size of the heart and fluid in the lung. For the echocardiogram, help to diagnose heart problems such as damage cardiac tissue, chamber, enlargement, stiffening of the heart muscle, blood clots in the heart, fluid around the heart, and damage or poorly functioning heart valve by the sound of waves such as ultrasound that create image of the moving heart. And lastly, for the cardiac CT or MRI, used to diagnose myocardial infarction and which more detail. And actually, cardiac CT scan is can show the image more detailed than the chest X-ray. So that's all for my part.
In a conclusion, there are many risk factors of myocardial infarction and other serious health conditions such as hypertension and diabetes. The possibilities of acquiring this disease are greatly depends on genetic factors and unhealthy lifestyle choices. But then, the genetic risk can actually be influenced by changing unhealthy lifestyle to a healthy lifestyle. This is because unhealthy lifestyle can increase the risk of developing serious illness. Therefore, Islam has also stressed on the importance of taking care of our physical bodies as it is a gift from Allah. Any kind of actions that could bring harm and cause damaging effects towards our body are prohibited in Islam, and this includes drinking alcohol and excessive smoking. This can be observed in many verses in the Quran that order Muslims to avoid drinking alcohol, stated in Surah Al-Ma'idah, which Allah says, "O you who believe, intoxicants, gambling, idolatry, and divining errors are an abomination of Satan's handiwork. So avoid that so that you may be successful." On the other hand, for those who already acquired and suffer from the disease, we are responsible to seek for cure and medical treatment, as it has been stated in hadith that Allah has not sent down a disease except that there is a cure. Thus, as a Muslim, we cannot abandon our body's health as it is a gift from Allah, and taking care of our bodies and health is one of the ways to express our gratitude to Allah for granting us this healthy body. In fact, being healthy can help us gain more energy and have a good stamina to perform more ibadah and becoming closer to God. So I think that's all from us. Thank you.